Everybody, welcome back to the general session. Our session here is Amplifying Voices, Advocating for the Facial Difference Community. If I can invite Adina, Luci, Becky, and Ellie up to the stage. Yeah, please.
Hi, everybody. Thanks for being here. One of the 4 pillars of Smile Train's strategic plan is fostering a global cleft community through awareness and education with the goal of reducing stigma and ensuring acceptance of cleft-affected individuals. By attending CleftCon and telling your networks about your experience here, each and every one of you is joining Smile Train in advocating for a world where every person has access to high-quality, comprehensive cleft care and is able to live a full and healthy life. Advocacy takes many different forms, and the panelists who have joined me here today each have their own inspiring journeys to share. So I'll briefly introduce each of them, and then we'll get started. Luci Capo was born with a complete bilateral cleft lip and palate. She's a retired RN, as well as a poet, podcast speaker, writer, and author. She's published several articles on craniofacial differences and a memoir. She's been actively involved with Smile Train's Cleft Community Advisory Council and is an advocate for the Ensuring Lasting Smiles Act. She conducts outreach to older cleft-affected and craniofacial-affected adults to help instill them with self-love and raise their self-esteem. Luci has been happily married to Dick Rome for over 24 years. They live in Kansas City with their dog, Gracie. Becky Abbott is the Director of Research and Treatment Advocacy for the National Foundation for Ectodermal Dysplasias and co-chair of the NFED Family Driven Advocacy Committee. She received her undergrad degree in biology from Mount Mary College and her MPH at Benedictine University. She resides in Slinger, Wisconsin with her husband Tom and 3 sons, Aiden, Ryder, and Lachlan. The Abbott family regularly engages in advocacy to educate members of Congress on ectodermal dysplasias, skin diseases, rare diseases, congenital and craniofacial anomalies, and other important topics. Ellie, Mador, is a public affairs professional with experience in the state government and health policy sectors. Her expertise includes supporting external relations and strategic communications projects to make healthcare systems more affordable, accessible, and equitable for all. She was born and raised in New London, Connecticut, and is the youngest of 4 children. Through her cumbersome experiences navigating the healthcare system as a child with a facial difference, she developed a passion for healthcare advocacy. She attended GW studying political science and public health and received her MPA from UMass Boston. She's proud to be involved in advocacy and engagement work with Smile Train and serves on our Young Leadership Circle Board as well as the CCAC. So let's get started. Luci, can you please give us an overview of your advocacy in support of older cleft-affected adults? What have some of you...
I'm sorry. Well, when I was coming back from CleftCon in 2022, I realized that there needs to be more attention placed on the older adult with cleft lip and palate. And so I went home and I also thought about inclusivity. And I thought, I have this mission for this diverse group that includes myself to receive more support in the community. So I did a research project and I reviewed several articles and projects, and I found only one inclusive article that included people between the ages of 57 and 82. And they were actually questioned, and it was a survey about what they thought about what was going on in their lives. And so this was a qualitative research project, and it was actually published in the Craniofacial Cleft Palate Journal in 2015. And what these people did is they said that they were resilient. However, they felt like they didn't have any contact with their peers. They also felt that they were isolated and that they did not receive proper attention from the medical community, which was mostly dentistry. So they also talked about being isolated, and they felt like they were being rejected because of their appearance and their speech. And there was also thoughts of anxiety and depression. And when I think about anxiety and depression, I think, gee, we need to do more studies. And so my interest is to lean toward more qualitative studies for this diverse group. So I also did some other readings and research, and I found that hearing loss is common with the elderly, and also it can occur with cleft lip and palate. I also found that in my research that the older adult tends to get a dry mouth with certain medications. And when you have a dry mouth, you can actually have tooth and gum disease. And gum disease can lead to systemic illnesses. So that was another thought that I had. And so I did go to the American Dental Association's website, and they do have articles, but nothing around cleft lip and palate or craniofacial difference where there is dental problems. So I also decided to get into writing articles and talking about my experience as an older adult with cleft lip and palate. And I even went to the Agency on Aging in my hometown, in my community. And I also spoke there, and I wrote an article in their local magazine for older adults. And I also reached out to national organizations, and so I start writing articles for professional journals and other magazines. And I did get some rejection, but I'm not done yet. I'm going to keep going. And so I also, I have, just to mention, I have a little article that's in the back of the room over by the hallway where the bathrooms are. I have an article there that was written in a professional journal, and it talks about social media, which was which was in the previous presentation. And 2 years ago, when I was doing my work, there was less attention placed on social media by the older adult. But now, I just read another recent article that was published. They did a poll on 2,000 people that was actually published in the New York Times. And they found that now, older adults are using let me get to my note, excuse me. That 75% of older adults are using Facebook, and also 28% are using YouTube, and 10% are using Instagram. They also said that they felt like by using social media, they were learning new things and they were connecting more with family members. So this brings me to reaching out to the older adult, because that's my goal, my mission is to reach out to them and let them know that they are not alone, and that we all have need to be heard, and we need to be seen, and we also want to have a happy and joyful and productive life, even though we're older adults with craniofacial difference, facial difference, and that we can connect together and again live a joyful life. So that's my story.
Thank you, Luci.
You're welcome.
Thank you for always being an advocate for the entire community, especially for older adults.
Okay, thank you.
And Becky, we've heard the word ELSA thrown out a few times today already. Can you explain what the Ensuring Lasting Smiles Act is, and how are you involved in lobbying for this legislation?
Sure. So first of all, I just want to say thank you to the whole Smile Train community for welcoming my family. It's been a wonderful experience to be here, so I just want to thank you all. So my oldest son, Aiden, who isn't here today, is affected by ectodermal dysplasia. He's missing many of his teeth. And our story began when Aiden was about 2 or 3 years old, and we noticed he was having a lot of issues with speech, chewing, swallowing. So we took him to his doctor. They didn't think that anything was wrong. We ended up seeing a pediatric resident at Children's Wisconsin, and that was the first time that we heard about ectodermal dysplasias. I always call that my day of answers and hope, that we knew exactly what we were dealing with, and we knew what our path forward was going to be. When we were talking to his maxillofacial surgeon that day, they assured us that all of the lifelong work that Aiden would need would be covered under insurance because it was a congenital anomaly. However, we quickly found out that that was not the case, and we had to fight ever since then to get coverage for all of his medically necessary surgeries and treatments. So that kind of took me down the path of advocacy. We are, and this is my family up here at different stages, but that took us forward to meeting with our county representatives, then our state representatives. Our state representatives told us that they could not help us get coverage. So then one day in the middle of February, I talked my husband into packing up and driving to Washington, D.C. to share our story with our federal legislators. My husband at that point told me that I was absolutely crazy and that for all of these years, nobody listened to us. Why would anybody in Congress listen to us? My son quickly, jumped on board and said he'd be happy to share his story. He then shared it with Senator Tammy Baldwin and her staff, and then ended up inspiring the Ensuring Lasting Smiles Act, which he had the honor of naming. Since then, the National Foundation for Ectodermal Dysplasias has led the effort to get ELSA passed. ELSA is federal legislation that is bicameral and bipartisan, and is very well supported in Congress. And what ELSA would do is it would ensure that anybody who is born with a congenital anomaly would be able to receive the medically necessary treatments or procedures or devices that they need. It would be covered under their insurance. So we're hoping that it will pass very soon, but not only does it help the ectodermal dysplasias community, it is very broadly written so that it will include the cleft community. It will also include the craniofacial community, as well as other organizations that have issues with their ears or their eyes. So that's how I became involved with your wonderful community. We all have the same struggles, and we never picked to be in this place, but through our struggles, we found unity and a wonderful community that's come together to push this legislation forward. It won't only help, my family or Luci or Ellie or so many other advocates that I've met here. It will help thousands of people across the country, and I think that's where we can all come together in one voice and raise our voices to get this important legislation passed.
Absolutely. Thank you, Becky.
Thank you, Steph. I appreciate that.
Ellie, could you tell us a little bit about what your journey to advocacy has looked like, and what does it mean to be a young advocate?
Yeah, hi everybody. My name is Ellie Mador. As Adina introduced, I am a health policy professional, and I currently live in New York City. This is my second in-person ClefCon, so I'm so happy to be here. I know we're getting toward the end of the day, but we still have a lot of things to talk about. So yeah, these are some photos of me as a child. And, like anyone, my journey to cleft advocacy began with being born with a unilateral cleft lip and palate. And I was actually born into a already cleft-affected family. You can see my dad in that photo at the top left. He was born with a bilateral cleft lip and palate. So it is a condition that I inherited paternally from my dad. I have 3 older siblings. They are not cleft-affected, and my mom is not cleft-affected. So as I mentioned, condition I inherited paternally. And in terms of my road to advocacy, on the other hand, I was born into a family of very fierce, civic, and justice-minded women. And so, as a child, advocacy was really prioritized. Justice-minded thinking was prioritized, and so I guess you could say that I inherited that maternally. And so with that blend, I feel like that's how I became the advocate I am today. Now, as a child, I was pretty naturally curious and assertive, but because I had a facial difference, I was also shy and quiet, like many kids that are cleft-affected are. Despite this, when I went to the doctor and I was in the doctor's chair, I really, from a young age, tried to maintain a level of autonomy and basically what that meant is that anytime a doctor or a medical assistant was going to do anything with my mouth, I made them tell me exactly what they were going to do. And I think that was just my way of controlling a situation that I really didn't have any control over. So, you know, that was really my first encounter with advocacy at a young age. Even though you have your parents, you're still the one getting the treatment, and so you do maintain a level of advocacy for yourself. So I really became passionate about patient autonomy from a young age. And if you want to cue the next slide that I have, like most cleft-affected people, fighting for insurance coverage is a constant uphill battle, unfortunately. And as I mentioned, my mom is a very fierce advocate, so she, you know, handled a lot of my treatment denials, and, you know, would constantly kind of say, kids, get out of the room, I'm gonna call the insurance company, and it's not gonna be pretty, so I don't want you in the room. There might be words said. So, you know, I was experiencing that as a kid, but I wasn't the one that was, you know, doing it. She was advocating for me. And then fast forward to June 2012, and I had just graduated high school like a couple weeks before. I just turned 18, and I was days away from La Fort One osteotomy, which a lot of people are probably familiar with. It's jaw surgery, very intensive. It's become now pretty standard treatment in cleft care. And it involves years of orthodontic pre-op work that my insurance company was reimbursing us for. Yet, days before the surgery was scheduled, you know, in the summer, so I could then go to college in August, my insurance company decided to deny coverage for this very expensive surgery. And we appealed, we did all the appeals available to us, and they denied the appeals, and then the last resort was a peer review, and they denied that. So we really were like days away from my surgery, and we didn't know what else to do. And so that's where you can see the letter at the bottom right. So my oldest sister was at the time in medical school in Washington, D.C., and she wrote to our senator. I'm from Connecticut, so Senator Blumenthal, who's also in that photo. And she wrote a letter, and reading this letter now as an adult, like just seeing how my sister advocated for me, she was 23 years old, and she's writing this very eloquent letter to our senator about, you know, what she sees in medical school and like in her clinician rotations, and what she's seen and how I had inspired her growing up to want to become a doctor. And so she wrote Senator Blumenthal, his team got in touch with us, and we eventually were able to get the surgery covered like literally hours before it was scheduled to happen. And during that time, everybody was advocating for me, but I also wanted to try. I wanted to pitch in. I was 18. I was interested in our political system. So I Googled like state laws in Connecticut for cleft lip and palate, and I saw that there was a state statute that mandated insurance companies cover for cleft lip and palate. So I was like, well, why are we having this issue? Like, there's a law, state law. Well, little did I know my dad's health insurance plan was self-insured, which means that state law doesn't actually apply to me, even though I live in Connecticut. So my health plan was subject to federal law, which is what also will change. And, you know, it was at that moment that I really saw that this is a systemic issue. This is a policy issue, and these are things that need to be changed at the top. And so that experience really, you know, as distressing as it was, it ignited my passion for advocacy within the political system, and I was able to blend my interests in government with my passion for improving the healthcare system, and I went on to study political science. I actually ended up interning in Senator Blumenthal's office in college, and working in constituent services, which was really like a full circle moment. And then I now work in the health policy sector. So I really am committed to advocacy, and I now as an adult and looking back at my experiences, I just want to continue to fix our system so that, you know, a lot of people don't have access to the things I had access to and the privileges I had access to. And we can't just make every family like go through this every time. There's a better way to do it. And so this last thing I just included, this just happened the other day, that some protesters were protesting United Healthcare, which is the insurance company that I was covered under, and protesting insurance denials. And they got arrested, and United Healthcare reports $7.9 billion in quarter two profits. So, you know, this is, insurance companies are for-profit, they're for-profit institutions, and we really need laws that will protect patients, because they're not thinking of you in the end of the day.
That's a lot you went through. Well, July was a very busy travel month for you three. You started off the month in DC. Becky's organization organized a day on the Hill, and Ellie and Luci, you attended as part of Smile Train's contingent there. Becky, could you tell us a little bit about what this event was? There's so much behind it. We can all tell what goes into making an event like this. And then I'd love to hear from each of you what maybe a highlight of that experience was for you.
Sure. So we held a Day on the Hill event. And what's really special about these events is that we invite any organization who is willing to advocate for ELSA to join us. We really try to be as inclusive as possible, because we believe that as many stories as possible that are shared on Capitol Hill will move this legislation forward. So we had several different organizations, including Smile Train, join us on the Hill, and I just have to say I'm blessed to have been with Iva, Ellie, Luci, who else is here? Steph, there's Ashley. I know that there's a whole bunch of other advocates here. I've been on the Hill before with Adina, but I'm just coming off of this high from being on the Hill just a week and a half ago, and those meetings were absolutely amazing. We've already received emails from co-sponsors in both the House and Senate saying they're gonna jump on this bill, and that's all because of every story that was shared. You know, Luci's story built upon Ellie's story, which built upon Steph, and then Iva and Ashley, and every single person who shares their stories moves the needle forward. Not just for ELSA, but for the whole craniofacial community, because this bill will help so many different organizations and so many different people who are advocating for ELSA. So one thing that I continuously hear on the Hill is that when the families who have cleft lip and palate, and then the families who have ectodermal dysplasias, and then the providers all share their stories together, it really creates a complete picture so that members of Congress fully understand why this bill is important, and then they can jump on board and support it. So I'm just thrilled that I was able to be on the Hill with so many passionate advocates, and I know that everybody here has been on the Hill a couple of times, and I've just seen so much growth, and I just want to say I'm so proud of everybody who's here that took the time on their July 4th weekend to share their stories. There's a million different things you could be doing on July 4th, but I think everybody in this community knows how important it is to get access to care. So it really shows what type of wonderful human beings you are to take the time, share your story, and try to advocate for an entire group of people who are really voiceless until, you know, everybody stands up and raises their voices together.
Well, thank you for leading this initiative, Becky.
It's my honor.
Luci, Ellie, do either of you have a highlight of the day you might want to share?
Yes, it was really exciting for me because I actually got to see legislators face to face rather than their employees. So I got to see Representative Dusty Johnson from South Dakota, and then in my home state, Congresswoman Sharice Davids. I got to spend a lot of time with her face to face. In fact, let's see. Yeah, that picture is she and I talking with our group. And then we also got to meet face-to-face with Senator Mike Rounds from South Dakota. So it was just so enlightening to meet them face-to-face and all of us tell our stories. And they were very receptive about talking with the others. So it was very wonderful, and I just loved it because you just felt so listened to. It was just a wonderful time for me.
I just have to mention Luci is a rock star. She was on so many different legislators' social media that day. They all took pictures with her and posted it and shared it. So it was amazing to watch. I just have to say, you're awesome, Luci.
Thank you.
I think for me, that last time was the second time I've gone, and I'm just in such awe of the people that travel, to Washington, D.C. from way further than I have traveled. Both times I traveled from either Connecticut or New York. And just seeing the community come together, also learning a lot about other syndromes and other conditions. I didn't really know a lot about ectodermal dysplasias. I didn't know the unique needs that patient population faces. And it's the same kind of system-wide issue in terms of policy to address it, but there's so many different needs, and I think showing that to legislators, putting a face to the issue in such a diverse way. So that was really great. I think, just seeing the community come together was really special.
Thank you all. One last note, we have a one-pager about cleft in particular and ELSA that we'll share with everybody via email after this. In this conversation, we've talked about the specific type of advocacy, lobbying for legislation. Obviously, you need advocacy in the workplace, in school, for yourself. What advice do you have to people who are looking to get started in advocacy but might not know where to start? Who wants to go first?
I can go. I think, for me, there's a couple of things. The first thing is identify your strengths. I think, today we've seen everybody who spoke today is an advocate, and there's so many different ways to advocate. So like for me, I'm really passionate about policy, and I'm passionate about like changing laws and about changing the healthcare system. But you might be really passionate about like beauty. You might be really passionate about awareness on social media, and like that might be a niche. So I think figuring out like how you can contribute and knowing that there's space for you. I think another thing is getting in a room with people who will inspire you, I think can really go a long way. For me, yes, exactly. So you all are already on step one. But yeah, I think for me, I really was ignited in college to advocate, and then, I graduated college, I started focusing on like making money and getting a job and things that you do in your 20s, and I feel like some of my passion fell off, and then I went to ClefCon last year, and you guys talked about ELSA, and I knew about ELSA, but I hadn't been advocating for it in person, and so that just kind of reignited it in me, and I've been really involved the last year. So I think just getting in a room where you're with other people that will fuel your advocacy.
I was just going to quickly mention anybody can advocate, and of course you probably are sick to death of hearing about ELSA today, but you can advocate for everything, whether it's in your doctor's office or your provider's office or your work environment or whatever it is. Advocate on every level, and make sure that you share your story. And I'll just quickly share a quick story about my very first time on Capitol Hill. We had the honor of meeting with Speaker Ryan at the time, and my 12-year-old son at the time was explaining about how he was having issues with chewing and swallowing and how he was born without so many of his teeth. And I can remember the speaker just stopping and looking at him and saying, I didn't even know this was happening, and that kids were born without teeth and needed all of these surgeries, and there would be no way that we could fix this unless you came to Capitol Hill and shared your story. So I would just encourage anybody, if you have the time, to be an advocate for yourself, because you don't know where your story is going to lead you, and you don't know what journey you'll be down. And I mean, not to mention it again, but I never thought that I would be going to Capitol Hill and sharing my son's story and being part of this amazing community. So you don't know where your story is going to lead you, and you don't know what type of support that you can garner that will help not only yourself, but so many others who are just waiting to receive their treatment. Everybody here is waiting for access to treatment. So just go out and share your story. You never know what's going to happen if you do it.
Thank you.
And to dovetail on that, you both have said a lot about what I was thinking is, I think about what is your intention? What do you want? What is important to you? And you go for it. Because if it's going to make a difference for you and it's something you really want, you're going to go after it no matter what.
Thank you all so much. This is, again, already a room full of advocates, and I know we're even more inspired to keep going and keep fighting. So thank you for sharing your stories.